It is now my distinct honor and privilege to introduce to you the School of Medicine class speaker for the class of 2015, Daniel Barry Maselli.
Hi, thank you. Sorry, I'm a little nervous, not about the speech, but I'm going down to Duke in a few weeks, and I was right about to ask Dr. Zhao if he'd be my roommate. Sounds good? I'm very clean. Thank you, Chancellor Collins, President Corrett, Dean Flott, our esteemed guests and future roommate, Dr. Zhao, our beloved professors, my fellow graduates, and especially to our families, loved ones, and friends who may or may not be here today, but without whom we certainly would not be. Graduates, it's an honor to address you today. And the administrators have asked that I remind you to fill out your post-graduation exercises evaluation, as its completion is required to be able to attend graduation exercises. That doesn't make any sense. Why did you have me? No. Like a number of my classmates, I knew I wanted to be a doctor from a very young age, more certain of it than anything. For me, it came down to knowledge. See, doctors, they knew so much. And I wanted to be that smart too, to have the answers to life's big questions, such as what is heart disease and how many is too many Chipotle burritos? So it was startling to discover during the first few days of my first year here that simply getting into medical school didn't immediately and automatically confer upon me any more wisdom than I'd previously had. If I wanted to someday be as knowledgeable as a resident or an attending, I would have to study like a lot. And just to fill you in, by the way, for folks who are not as familiar with the medical school educational hierarchy, it goes something like this. In terms of clinical expertise, it's a medical student, resident, and then attending physician, with the exception if you're in the OBGYN and women's health department, in which case it goes a medical student, resident, attending physician, a congressman. It's true. Ooh, sassy. But even after finishing the world's most expensive Netflix subscription, or as this university insists on calling it, the 4th year of medical school, it has been even more startling to realize just how little the scientific community understands about the human body, medicine, and disease. Although the signs were there all along, like when during our first 2 years, lecturers would joke, so guys, half of what we're teaching you right now will probably be wrong by the time you practice. We just don't know which half yet, and we'd all laugh and laugh and laugh, to keep from crying. Even our most sensitive diagnostic tests have some inherent non-zero amount of uncertainty when you interpret their results. Kind of like how Worcester's Lake Quinsigamond actually has, and this is true, an acceptable non-zero amount of fecal content. So it's a pretty fitting neighbor for the hospital. After all, in medicine, like Lake Quinsigamond, there's always going to be some level of crap that you'll have to put up with. So mostly, we've just been learning that there's a lot we don't know about patients, our treatments, and even ourselves. Our education does not give us a crystal ball, which is just as well because I'd probably end up selling it on eBay to pay my learning contract off. While medical school affords us many privileges, the privilege of education, of caring for patients, of wearing a white coat, of being around all of you, it also grants us the privilege of uncertainty. Uncertainty is a privilege, because that idea that medical school that it must make me smart, that's a treacherous path towards a medical culture that makes us wary of saying, I don't know, or even, I need help. Uncertainty replaces that with a respect for curiosity and humility, providing fertile substrate for a meaningful and productive and lifelong education. Uncertainty is a privilege because it brings our fears and doubts into focus and renders us patients of our own experiences. Embracing this brings us closer to our actual patients. We should use these connections with those in our care to nurture our empathy. For instance, I try to remember that I, like many patients, was put on a 2-month-long wait list before UMass would let me in. Uncertainty is a privilege because it means these past 4 or more years have been meaningful enough to sacrifice something, likely many things, to complete them. As a result, I know I've put my dedication to this goal on trial more times than I can remember. Those challenges, studying for board exams, arriving early, staying late, turning down social invitations, doing your financial exit counseling, and finding out that all those loans you took out over the past 4 years were, unlike a game of Monopoly, not actually dealing with fake money, but also like a game of Monopoly, and that the only car you'll ever be able to afford is about the size of a thimble. Those challenges made me question this path that I had thought I wanted since I was a chubby, asthmatic 7-year-old with a bowl cut who sometimes tucked his sweaters into his pants. And much like that image, self-doubt is uncomfortable to think about. It can be downright scary. Sometimes I didn't know what to believe, just like the time Chancellor Collins told me there was no residency in reverse psychology. But each uncomfortable pause, however momentary, that makes us ask, was this worth it? That's just further proof that it was. Like bone that is daily broken down to be rebuilt healthy and strong, so too does uncertainty put cracks in our resolve to empower us to build it back up more fortified and resilient than ever. Uncertainty is a privilege because it means we're aware that others have made tremendous sacrifices to help get us here. My mother, who pushed me to be the very best version of myself, allowed me to strive to do the same by putting a premium on scholarly pursuit, funding my high school and college educations when she could, and taking out loans from my grandmother when she couldn't. Residents, fellows, and attendings, those tired, overworked, white-coated ghosts of missed Christmas's future, they took the time out of their busy schedules to shepherd us through our clinical years. Our patients and their families, just as tired and overworked, gave up comfort and privacy for the sake of our educations. This goes all the way back to our very first patients, our anatomy lab cadavers, who literally gave all of themselves for our learning. These people who scythed a path before us or linked their arms with ours and marched at our sides or tirelessly pushed us onward from behind. They have enabled us to be surrounded by love every step of this journey. And when that shifts the question from, is this worth it, to, am I worthy? That's a privilege too. Uncertainty is a privilege because it creeps in through our ears and nose and eyes and burrows deep, makes a home among our nodes of Ranvier, our islets of Langerhans, our crypts of Lieberkühn. And in doing so, uncertainty isn't a symptom of inadequacy. On the contrary, it immunizes us against complacency. It says, study a little harder, check in again with that patient, broaden your differential, seek the wisdom of others, and above all, be humble. In short, it makes us better physicians. Indeed, to be uncertain is to do the very thing this wonderful place has been trying to teach us to do since day one of our doctoring in clinical skills course. Ask questions, often. The more open-ended, the better. But in the end, my friends, amidst that privilege of uncertainty, there are a few things of which I'm quite certain, yet which remain no less of a privilege. In medical school, whether we were breaking the bank, bad news, or sterile fields, we did so alongside the most talented and hardworking peers, challenged by the most caring and dedicated instructors, and inspired by patients gracious enough to let a fumbling and awkward medical student pretend to know how to use a stethoscope and a clownishly oversized white coat while asking about their most intimate medical histories. You are, all of you, so special to me, and it's an honor to know you. There's definitely something here in the water at UMass Worcester. I'm not sure what it is. All I know is it's not fluoride. And remember, while our student debt may be vast, it's nothing compared to the incalculable debt we owe those who are sitting around us today. If we're lucky, we'll get to keep taking out those metaphorical loans. I'm fortunate to know my friends and family will continue to show me the love and support through residency in the same way they did through my medical school education, by asking me to look at their rashes and taking bets on how much weight I'll gain. Ultimately, our education, it's not a price tag. It's not a bunch of test scores or a framed piece of paper. It's also not over. So what exactly were these past 4 years then? Again, I can't say for sure, mostly because the question wasn't framed in a multiple choice format, which is all I can really do at this point. So I don't know, but that's okay. There's always some inherent uncertainty that we have to accept, actually, that we should celebrate in medicine. And what a privilege that is. Thank you, congratulations, and good luck to you all.